Okay, so this is my wound dressing checkoff. So the way I'm going to start is I'm going to verify my physician's orders. And the way I do it is I verify the patient's name, Jack Buzzard, date of birth 6/20/19XX. And the procedure we are doing is we're doing a wound redressing. So now that I verified my orders, I go ahead and go to the patient's room. Can you verify your name and your date of birth? Patient verbalizes Jack Buzzard 6/20/19XX, and I go ahead and verify with his wristband as well. Wristband says Jack Buzzard 6/20/19XX. So now that I verified my orders, my patient, I want to assess for allergies and explain the procedure and introduce myself. So good afternoon, Mr. Buzzard. My name is Eddie. Today we are doing your wound redressing. And do you have any allergies, anything like tape or anything like that? No? Okay, good. So I put the bed to a working height. I lower the rail down to the side that I'm going to be working on, and I want to perform hand hygiene and place some gloves on. Okay, so I have my gloves on. Now I want to gather my supplies. Before I start, I want to make sure I have a clean working area. So I'm going to carefully unpack this. Just like that. Making sure the side that I'm working on does not touch anything that's dirty. So now that I do that, I'm going to place my pad underneath my under the wound, so when I irrigated it, it doesn't make a mess. Okay, so now I have my piston and its piston's cup. Have my Q-tips. I have my irrigation tray that I'm going to place under the wound. So when I'm irrigating, all the fluid goes in the irrigation tray. I have my gauze. I have my new set of ABD. I have my sterile water. I have my biohazard bag. My measuring guide. My tag so I can label it after I complete the procedure. So now that I can go ahead and begin. So the way I want to begin first is I want to set up my biohazard bag. I'm going to keep this so I can rebag the biohazard bag. So I'm going to keep it right. There's not much room in here, so I'm going to keep it. I'm gonna keep it propped. I'm gonna keep it propped up here. I'm gonna keep the bag over here, propped. So what I want to do first, now I can go ahead and unpackage the wound. So the way I'm going to start first is I'm going to peel off the ABD and peel off the tape. Okay, so I peeled off the tape. Now I can carefully and gently take off the ABD. I want to examine it for any exudate. If it has bodily fluids, I would put it in the biohazard bag. If it is clean, I will place it in the trash. So I'm assuming this has bodily fluids. I would also note the color, the odor, the consistency, and the amount. Once I do that, I will place it in itself and I will dispose of it. I'll dispose of my tape in my trash. But for now, I'll place it in here. So next, I will take off the dry gauze. So I would carefully peel it out. Also, I would notice the exudate and also examine how many was used. So 4 gauze was used. So once I do that, I can go ahead and fold it in itself since it has bodily fluids and dispose it in my biohazard bag. And then I'm going to take off my wet gauze. So the way I do it is carefully peel it out as well. Examine it for any exudate, noting the color, odor, consistency, and amount. Also, I'm unraveling it as well to see how many gauze was used, so it can also give me a great picture to note how much to use. So I have a total of 3 pieces of gauze. Again, I want to hold it in my palm. I want to take off my gloves just like this. And then I'll put it in the biohazard bag. And I'll perform hand hygiene and place some new gloves on. So now that I have the new pairs of clean gloves on, I want to irrigate my wound. So how I do is that I want to get my sterile water. I want to pour it in my piston cup. I want to draw up the fluid. After I draw up my fluid, I'm gonna make sure that my piston does not touch my wound. And with this one, I wanna make sure if if the wound is on the thigh, I wanna position the thigh over the irrigation tray. Since this is in a weird angle, I'm just gonna hold it up. The way I'll do it is I'll start from to least contaminated to most contaminated. And I would pump and stop. Start over. Pump and stop. Pump and stop. Pump and stop. Okay, so once I do that, I can go ahead and put this back. I'm also noting the fluid, the color of it, the amount. So once I do that, I can go ahead and measure my wound. So the way I measure my wound is I'm going to use my measuring guide. I make sure that my measuring guide does not touch my wound. So I'm going to first measure the length. I'm going to hover over the wound and I see I have 12 centimeters. I am then going to measure the width. And that's 2.5 centimeters. Then I'm going to make sure I document the depth. The way I document the depth is I want to go to the deepest part of the wound. And then I'll use my measuring guide. And it is roughly 3.5 centimeters. So once I get my my measurement, I can put this in the biohazard. I have another Q-tip which I'm going to use to make sure it's packed correctly. So once I document my length, width, and depth, I can go ahead and begin packing. So the way I pack is I want to get my tray. I want to place a minimal amount of water in here. And then I'm going to begin packing. Okay. 3. So I do note that I used, the last package had 3 pieces of gauze. So I'm going to cut 1 piece because this has a total of 4. I'm gonna cut them individually. Okay. And I go ahead and place my gauze, making sure that it is not too wet, making sure it's damp. I want to aerate it. Well, I'll put all my pieces of gauze in here. Okay, so once I got that, I can go ahead and place my pieces of gauze in here, making sure it's not too much clumped together. It's aerated. Okay. I want to place it in here. I'm going to adjust it using my Q-tip, making sure I get all the edges from top to bottom. Then I'm going to continue. Again, making sure it's not too tight. I also want to make sure that I'm using my Q-tip so I can push it away from the good, fresh skin. Oh. No. Okay. And I would push it away from the good fresh skin. Okay. So that is my wet gauze. Now I'm going to put my dry gauze. I note that 4 pieces of gauze was used. On my previous one. So I'm going to place the dry gauze neatly around the area, just like this. Then I'm going to get my ABD. Gonna try to hurry because I got about a minute left. Get my tape. First tape my short sides. Then tape my long sides. And then once I tape that, I can go ahead and dispose of all the equipment that was used by the procedure. Document the color, odor, consistency, and amount. Document the length, the width, and the depth. My expected time of return. Call light within reach. How the patient tolerated the procedure. Document per facility protocol. And I would dispose and I would rewrap this biohazard bag, and that's it. And put the bed to its lowest position. Rail back up, and yep, I messed up.